Hi everyone, this is Lenore, the Medicare lady, and this is 7 questions you need to ask before going on Medicare. Let's start with question number 1. What is Medicare? Very simply, Medicare is health insurance. Specifically, Medicare is the federal health insurance program for people who are 65 and older, certain younger people with disabilities, and people with end-stage renal disease. That's permanent kidney failure requiring dialysis or a transplant, sometimes called ESRD. So even though Medicare is simply health insurance, it's really confusing to folks, and that's because it's not like an employer health insurance plan. So let's take a look at some of the key differences between Medicare and an employer plan, or maybe a private insurance plan that you might have purchased under the age of 65. First off, Medicare has parts, and they separate your hospital, doctor, and drugs into parts, and you have to purchase each part to have complete coverage. An employer plan, on the other hand, will typically cover all your stuff under one plan. The second thing that's different about Medicare is that it is for the individual only. So husband and wife would not be on the same Medicare plan. Whereas with an employer plan, you can usually sign up with your spouse and children. You can have family coverage with an employer plan. Medicare, they only sign up you, and your spouse would have their own Medicare plan. And the third difference with an employer plan and Medicare is that Medicare pays about 80% of your expenses, you pay 20%, but there's no out-of-pocket cap with Medicare, no out-of-pocket maximum. So you could be paying 20% up to like $1 million or more. Now, hopefully that won't happen, but there's no out-of-pocket max with Medicare. That's why you're going to pick up a secondary insurance or Medicare Advantage, which we talk about in another video. An employer plan, on the other hand, you have copays, deductibles, and out-of-pocket maximum. So most of us, we're used to going to the doctor, paying a $20 copay, maybe having a deductible, and our expenses are capped at what's called an out-of-pocket maximum of maybe $6,700 for a plan year. One final note about Medicare is that it is not Medicaid. I know they sound alike and people really do get them confused. They say Medicaid, Medicare. Well, they are different. Again, Medicare is health insurance for folks who are 65 and older, whereas Medicaid is public assistance health care for low-income Americans regardless of age. Medicaid is usually a state-run program, and you do have to qualify based on your income and your assets. Now, it's possible to have both Medicare and Medicaid at the same time, so if your income is below a certain threshold, we can talk to you about that and get you extra help if you need it.